one versus that one. See, other than the hilar and the paratracheal lymphadenopathy, those lungs are normal. Those lungs are normal. The radiolucency is normal, vascular distribution is normal, there's no interstitial disease, there's no airspace disease. And then look at these lungs. See, what's different about these lungs versus those?
Bilateral, diffuse, non homogeneous.
Yes. Bilateral, widely widely spread, non-homogeneous increase in density. And those findings are typical of bilateral, widespread, non-homogeneous increase in density.
Interstitial.
Interstitial disease. That's the middle of the chart. That's the middle of our flow chart. Interstitial disease. Does this look like dots or does it look like reticulation?
Dots.
It may actually be both. But there's also, if you look, you see there's a little bit of fuzzy density kind of right through here, maybe a little over here, a little down in here.
Some little airspace.
Yeah, there may be some little patchy airspace consolidated areas in here also. Sarcoid is another one that can fit into the interstitial and airspace consolidation category, which was the third of our radiographic signs. Remember, airspace, interstitial, and both. Airspace disease, consolidation atelectasis, interstitial disease, combined. That was our three categories from last quarter. And sarcoid can give us both. But what do you think about the hilar areas that we can see in the right paratracheal? Do you see any lymphadenopathy here like over there? No. In most patients, they go from that to combining lung disease with it, and then the lymphadenopathy goes away. So this patient probably has already gone through the lymphadenopathy, and they're in the lung disease stage without the lymphadenopathy. Lymphadenopathy's gone, which is generally kind of about the third stage. The problem with this patient's got about a 20-25% chance of ending up with widespread honeycombing. Because about 20-25% of sarcoid patients end up scarring the lung. They end up scarred. And when they scar, they can get cicatric scarring, like this one, or they can get honeycomb fibrosis all over. This patient get it all over both lungs. But this isn't, we can't look at this and say, gee, what a nice sarcoid. That, oh yeah, sarcoid would be right up at the top of the list. That's basically going to be sarcoid or lymphomas, really. It's a pretty short differential. Yeah, it might be Castleman's, but it's probably, sarcoid or lymphoma. This one, when we don't have the 1, 2, 3 lymphadenopathy, then we can't be as sure. Then it becomes more nonspecific. But sarcoid patients tend to have mild symptoms. They don't tend to be really, really ill. But if you look at it the other way, this patient's got probably a 75% chance of going back to normal, of ending up back to normal. So how would the pulmonologist treat this? It's chronic inflammatory.
Steroids.
Yeah, corticosteroid. So what's the pulmonologist trying to do with this patient? Push them back to normal. Because if they go across the line into scar, they're done. You can't come back once you cross that line. So they're just trying to push the patient over back to normal is what they're trying to do. And most of them end up going back to normal.